Hi, I'm Randy, Chief Technology Officer for BDI Laboratory. Well, today is a very special day. Not only are we going to talk about a topic that I really like, but we have a couple of special guests. We have Dr. Jill Rubin and Dr. Cynthia Morrow, both that are going to be covering some case studies with us. What is the topic? Topic is vitamin D, what I like to call the most important hormone. What hormone are we talking about? Calcitriol. Sometimes people don't realize that's what vitamin D becomes. And in fact, that's why we're going to cover in today's session here. We're going to cover different forms of vitamin D. It's very important to understand that. We're also going to cover intracellular calcitriol formation. Yes, many cell types outside of the kidney regulation can make its own calcitriol. And we'll talk about the biological effects of calcitriol in all these regards, because I would have to say calcitriol, which is why I call it the most important hormone, it affects so many different tissues and cell types within our body, unlike other hormones. It really is important. In fact, honestly, without it, you'd die. And we're going to talk about the sad fact that cats, dogs, we don't have enough of it. And that is a key problem here, which we work to fix. You got to test it. We have a very simple way of treating it. We'll cover some veterinary studies and some recommendations to test. But let's begin by acknowledging the fact that cats and dogs don't make it by the sunlight. It's a dietary feature. It's something they're going to have to eat to get. And so it comes into the body primarily as vitamin D3, although it can also come in as 25-hydroxy vitamin D from what they eat. When it comes in as D3, it gets hydroxylated in the liver with a little purple there, Mg, standing for magnesium. Yes, magnesium is necessary as an enzymatic cofactor for vitamin D to be hydroxylated to the 25 position to make 25-hydroxy vitamin D, which is what we test for. It's a primary store. This gets hydroxylated again in the 1 position, so 125-dihydroxy vitamin D, or let's just call it calcitriol. Again, you'll see the little purple Mg standing for magnesium that is necessary for that hydroxylation step, but it is also necessary for the PTH receptor to actually work. So magnesium is really quite important and something that I highly recommend you test your patients for as well. And in fact, the reason why we bring it up, or I bring it up here, is because there's a high corollary between low vitamin D and low magnesium, as you can imagine from this diagram. Now, it is a fat-soluble vitamin, so it's going to take about 2 months for equilibrium to occur. And in obese patients, because they have more adipose tissue, it's going to take about 4. But it doesn't stay around for long. It's got about a 2 to 3 week half-life. Gets hydroxylated in the 24 position and goes right on down the drain and eliminated from the body, which means that it's not always coming in. It's going right out. And so this is important to know, like if you have a patient that's got vitamin D toxicity or something like that, often you don't get into with hypercalcemia. Dogs and cats can actually handle pretty high concentration of vitamin D. But just eliminate the source, and in 2 to 3 weeks, half of it's gone. So it can get cleared pretty quickly. Now, certain cell types and tissue types can actually make intracellular calcitriol. So now, of course, there's a VDR, which stands for vitamin D receptor. It brings it into the cells. It can bring it in straight, calcitriol straight into the cell, or it can take the 25-hydroxy vitamin D, and it has these cells have the enzyme to actually hydroxylate it in the first position to make 125-dihydroxy vitamin D. And which types of cells are these? These would be renal cells, white blood cells, certain type of immune cells, epithelial cells, bone cells, and placentia. Yes, the placentia actually has vitamin D receptors, which is very important for fetal development because it does have some differentiating effects. And what are those biological effects? Well, first of all, as we all know, it's got calcium and phosphate homeostasis. It's going to increase intestinal absorption of both of these elements, stimulate bone resorption, as well as renal reabsorption. So it's very important in regulation of these things. Bone health, it actually affects bone mineralization. So the matrix of the bone is heavily influenced by vitamin D. It's got an immune system modulation. So a lot of white blood cells can make calcitriol intracellularly. A little tidbit here is that hypercalcemia of malignancy, which is an sort of ex-parathyroid generation of calcium has to do with the fact that white blood cells are secreting calcitriol in hopes of differentiating those de-differentiating cancer cells. So that's why you have hypercalcemia malignancy. It is certainly important for cell proliferation and differentiation, as well as cardiovascular health. So the heart also needs vitamin D. It helps to regulate blood pressure. If you ever go see a cardiologist, often they'll test for vitamin D to make certain that your vitamin D is sufficient, and if not, they'll get you sufficient to help lower your blood pressure. Skin health. It actually has a lot of skin benefits, which is why in a lot of products you'll end up with vitamin D analogs. Hormonal regulation. Well, we know it regulates PTH, but did you know it also helps regulate insulin? See, it has a lot of different effects, a lot of different tissue types are all being affected by vitamin D. Again, why I believe it's the most important. Even affects our mood. It has neurological effects, which is maybe why, when the sun's out and you're not feeling so great, you're kind of in a foul mood, you like want to go out, just go out there and look at the blue sky and get some vitamin D and feel better. So let's hear from Dr. Jill Rubin. She's going to be covering an interesting case and learn about how vitamin D plays a role in companion animals.
Hello, my name is Dr. Jill Rubin. I own and operate an integrated veterinary practice just outside of Sacramento, California for the past 26 years. And I wanted to discuss today a little bit about vitamin D and how important it is in our pets. So I'll get started right away. This is Tulip. She's a 2.5-year-old spayed female boxer dog, and she lives in Northern California on a hobby farm. And I want to make note that it's important to find out the complete history of your patients. And I'll divert to that in a few slides ahead to show how this will tie in with some of the history and some of the treatment. So let's move ahead. Tulip came to me when she was about 6 weeks old. The breeder gave me a call and said that she wasn't walking. And if you can look at her here, she's a cute little munchkin. She's walking really difficultly, and the breeder took her to another vet, and they put her on prednisone and gabapentin at 6 weeks of age because they didn't know what was wrong with her. They took an x-ray, they couldn't see anything. And so he called for a second opinion. The part of the history that I asked him was about her diet, and he was feeding her an all raw food chicken diet with organs. And she was a 6-week-old puppy. So not really the great plan. I'm not against a raw food diet, but certainly when it's not adequate nutrient wise for a young dog, we need to make sure that we're feeding a species appropriate diet at the right age. So about 6 weeks of age, we did some x-rays on her, and it found out that she had 3 pathological fractures in her lumbar vertebrae, causing her to walk with this abnormal gait. And here are x-rays, pretty interesting. It turns out she had rickets, which is a vitamin D deficiency, and she had a comminuted fracture of the L6 vertebral body, which you can see here up in the screen. And she had a compression fracture and a subluxation of L7. She was in pretty bad shape, actually. And she had also some questionable fractures of L5S1. And the radiologist had recommended a CT of her lumbar spine. They opted not to do that. They wanted to wait and see. They also noticed some mineral reduction in her pelvis and her proximal femurs. You can see they're pretty thin here. And so we went ahead and started supplementing her right away with some vitamin D. We put her on 100 IUs a day, which is one of the suggested doses. We did not test her at that point, but we went ahead and put her on RX Vitamins Vitamin D to start. And we changed her from a raw food diet to a commercial canned food diet. We put her on some probiotics, a half a scoop twice a day of the RX Vitamin Biotic and the Ultra EFA, which is a wonderful fatty acid to also help with immune support. And then a few months later, we went ahead and tested her for vitamin D. And if you can see over here, it's saying she's insufficient. It's at the time of the draw, we did 100 IUs per day. And so they went ahead and tested her and they said she was insufficient. Normal numbers are anywhere between 100 to 150. So she was definitely low. And what I really like about this test is it will give you the exact dosage that your pet needs or the pet patient needs to make sure that vitamin D deficiency is being treated properly. And if you look down here, actually, they say to go, the low end is 200 IUs, the high end is 400 IUs. So we went ahead and we did 3 drops a day. We went in between just because we didn't want to overdo it either. And we didn't really have a baseline, which I encourage people to do baselines. At the time, we were unaware of that. And so this still had a lot of value, this test. We increased her, and she was really doing nicely. So several months later, we put her on the vitamin D and we were going to retest her, but she ended up vomiting up some digested food. She started to have loose stools that were occasional, some flatulence. And so we did a fecal flotation on her when she was a pup. She was positive for Giardia. And we had dewormed her several times with Panicure. But we just couldn't seem to get the diarrhea. It was very intermittent. She had a lot of gas. Even though she was on probiotics, we decided we would do a GI microbiome panel on her from BDI. And these are the results. Um, we also repeated a vitamin D test as well. And you can see the last number was 78. This has gone up to 118, which is fabulous. She increased really nicely right into the normal range. So I really want to stress as well, too, that when you do these tests, make sure your technicians put all the data in. My technicians forgot to put this dose at time of draw in, and the test will ask you that. It's really important. So it's important to have the application date, the blood draw date. And on a side note, I always draw a little extra and I keep an extra vial in my freezer in case for some reason the test is inadequate, your technician doesn't put enough serum on there, the test gets lost in the mail. That way we don't have to drag the patient back into the clinic. We have it. It's good for several weeks in the freezer. We can always send out a new one if for some reason, and I'm just stating that because I've learned by the mistake. So we just keep a dated tube in our freezer until the test is completed. So at this time, she was sufficient. So we kept her on the high-end sufficiency. We kept her on the 300 IUs. She was maintaining really nicely on that. We were using the RX Vitamins product, the regular, it's 100 IUs per drop. Vitamin D, they do make another one, the Forte, which is 500 IUs per drop. That was way too much for Tulip, so we used the lower concentration. And as you can see here, we also checked her vitamin B12, and it was a little bit high, but we didn't worry too much about that. It wasn't too bad. It was still not in a danger zone, so we wanted to do some dietary adjustment. We did not have to give her a vitamin B12 supplement, which a lot of pets will need at times. So this is the microbiome panel that we did. We decided to do a fecal test on her, a fecal microbiome. Because of the diarrhea, we wanted to rule out, just in case if it wasn't some sort of small bowel intestinal disease, or if it wasn't something else underlying. And remember, I had mentioned in the beginning that I took part of her history and she lived on a small hobby farm. Well, if you look at the very first bacteria here, Streptococcus equus, that makes sense, right? She's living on a farm. So a dog living on a farm versus a dog living in a big city is going to certainly have a different load of bacteria in their gut relative to where they're living. If you look over here, these are all normal. So she had a normal gut load of these bacteria. There's an intermediate here, which is a little bit high. And then if you look down below, there's fungus, right? They do a ratio of bacteria to fungal in the gut. And she actually was normal. This is a nice normal wheel. She had a little bit of a high candida growth in her gut. So we made sure about the probiotics. We made some dietary changes again, but we ruled out that it could be the Giardia causing this intermittent flatulence and diarrhea. So this test actually is a pretty good test. Sometimes we use this test to determine which antibiotics to choose if they have some sort of a bacterial overgrowth, but she really didn't need to have that. We just did supportive care. We did some ozone therapy, rectal ozone on her. And we also, just not to digress, but for her spine, we did laser therapy, shockwave therapy, herbals, acupuncture, things of that nature. And then we went ahead and retested her again afterwards. months later, on another vitamin D test. And look at that. She's sufficient. She's right smack dab in the middle of normal. Normal is 100 to 150. She was at 128. And now look, isn't this cool? She doesn't need it anymore. We reversed that vitamin D deficiency. But if you look over here, we took some x-rays, and this is now her a little bit later on, right? A little more, still a pup, but if you look at that spine, it looks like an older dog actually. But you can see where the spine is fused; it's healed itself. You can see where the fracture is actually starting to come together, because initially she was low in calcium, hypocalcemia, which reversed, and the vitamin D. I attribute the vitamin D to that as well. And so she is a normal dog now. You would never know that she had a broken back. She runs and plays. And we did all this mostly through dietary and testing, and we reversed her symptoms. So I wanted to touch on a few things in conclusion: how important vitamin D is for pets. It's an essential vitamin for the health and well-being of pets, including not just dogs, but cats and other mammals as well. It's a very important supplement that we want to make sure we don't over supplement, because you can cause other conditions. So this is why I like to test to see exactly what numbers, and this test does that. It makes it so simple for the veterinarian. It's very economical. It's an easy test to do. It's just a simple blood draw with some serum that you put on a well. You seal it up in an envelope and you mail it to the lab, and within a week you get your results, which is fabulous. So touching on adequate levels of vitamin D is really important. It supports a physiologic function, including your bone health, your immune function, and cardiovascular health. One thing that I always get asked when I recommend a vitamin D test, which is pretty much to almost all my clients now, no matter how old or how young the pet is, because vitamin D is essential, right? And 75% of pets are vitamin D deficient. So why not find out which ones are? It's a misnomer that they're getting vitamin D from the sunlight. Well, everybody says, well, we're getting it from the sunlight. Why aren't they? Well, their coat blocks it. That's a really important fact. And so typically the way they're getting their vitamin D is through absorbing in the gut. It's all through diet and supplementation. And if the gut is out of balance, then they're not going to get the vitamin D that they need for absorption into their system. So it's really important to feed a species appropriate diet, look at a balanced nutrition, look at the balanced supplementation, and to make sure that they're getting optimum levels of vitamin D. So by understanding the significance of vitamin D and taking the appropriate measures like testing, and I think it's a good idea, even if your pet is normal, to test once a year minimum. If they're abnormal, we usually do a test, the first test, that we repeat it in 3 months, depending on what that number is in 3 months. We may try to do it again in 6 months or a year, but it's important to continue testing if the pet has been deficient the rest of its life. And pet owners and veterinary professionals can actually contribute to the overall health and longevity of animal companions by just doing this simple test, or even a microbiome test. It's made so simple, and it makes you feel good, because it's a natural way to help your pets for their overall immune system. And any pet that has exposure or has been diagnosed with cancer, skin disease, allergies, all of those things, most of those animals, I will say, are vitamin D deficient. So that should be a very valuable part of a workup for a patient, and it should just be standard of care. So you can see I'm pretty passionate about vitamin D. I can't say enough good about it. And I wanted to say thank you for allowing me the opportunity to share this case. And if anybody has any questions, feel free to reach out.
Well, thank you, Dr. Rubin. And boy, Tulip is one cute little dog. And I'm glad you were able to really save her and correct her problem. And it's not that unusual, even for a puppy, to have low stores of vitamin D. Now, that obviously was extreme, but low stores of vitamin D is a problem in our companion animals, and it's mainly because of the protein source. This was a study that was done by Tufts a few years ago. And they looked at a variety of different pet food manufacturers, looking to see which ones, might provide sufficient levels of vitamin D. And more than 75% of the cases, it was almost a 400 dog cohort, were found to be insufficient. And the main reason has to do with the protein source. Now, if you're looking at chickens in a coop, versus a wild salmon that's out in the sun, it's going to be different. And that difference is reflected in the vitamin D content of the protein, which then, if consumed, is going to reflect a difference in the companion animal. And this particular cohort, the reason why origin is pointed out there in the sufficient category is because it happened to be wild salmon. I mean, that was the main protein source versus, for example, chicken. And I'm not saying all chicken is bad. All I'm saying is that the protein source is the primary source of vitamin D, not what is added by the manufacturer. So I think that's quite important to realize. But there are other factors as well. The older the pets get, the older you and I get, there's less absorption. Intact status, when you spay and neuter an animal, it's going to drop. Neutering a male dog drops by on average about 27%, and in female dogs around 9. So it is quite impactful. The reproductive hormones do play a role in vitamin E metabolism. And certain medications, such as NSAIDs and corticosteroids, are certainly going to affect it through different mechanisms. One has to do with NSAIDs. If it creates any kind of ulcerations, it's going to affect absorption. And in corticosteroids, actually, vitamin D and corticosteroids actually work in synergy with one another. In fact, there's some really interesting studies looking at atopic dermatitis dogs on corticosteroids. And in fact, when they're given vitamin D, there's a thing called steroid sparing effect, which means you can use less corticosteroids to get the same intended outcomes. Certain diseases, certainly inflammatory bowel disease is going to be a big one, or intestinal lymphoma. Those are for sure going to end up being, low if not deficient, and certain breeds are predisposed to low stores of vitamin D. And so vitamin D insufficiency is something that we like to think about as more of a disease prevention campaign. Low levels will lead to problems. It's going to affect so many different metabolic processes within the body that it can lead to these problems over time. It becomes a chronic problem, and these problems boil and simmer until finally the patient has an acute problem that's then clinically present. But if sufficient levels are maintained, then we have a prevention campaign. We also have what is known as, it has an anti-inflammatory role. Of course, it improves immunity, even helps to fight infections. So vitamin D sufficiency is something that's cheap and easy to do. Now we have a test and treat campaign, which is easy to do. You just test and then supplement. We work with RX Vitamins. They have their RX D3 and D3 Forte, which we then tell you exactly, both in international units as well as how many drops of the RX product, then will correct the situation. And this is the vitamin D report. We'll highlight the results, of course, what the dose is. We keep track of history, and we give you interpretive comments as well as a retest date. That retest date then is the 2-month time frame for equilibrium to occur. Now, why do we 25-hydroxyvitamin D? Well, if we look at the relative concentration between calcitriol and 25D, there is a 4 times order of magnitude higher concentration of 25D than calcitriol. So when we're looking at intracellular calcitriol, well, there isn't that much calcitriol around to bring it into the cell. So the primary modality of this is 25D, bringing it into the cell, and then the cell making its own calcitriol for all of the various gene transcription and other effects that vitamin D has. And so this is one of the reasons why we measure 25D and not calcitriol. Now, there's a growing body of evidence in the companion animal space. VDI actually has a compendium of all this literature. It's something you can get from our website. But the number of studies in the companion animal space is just growing like crazy because more and more researchers are seeing the fact that vitamin D is playing a big role in so many disease processes that it is really quite important and something that really should be tested for and treated because it's cheap. I'm telling you, it's like the cheapest thing that you can do to help prevent diseases. And when the studies start showing that there's a 4 times higher cancer risk, there's a 2.5 times higher cardiovascular adverse effect of this, death and mortality and infections and allergies and atopic dermatitis and kidney disease, and the list just goes on and on, that it is worth your time to take a look at vitamin D to do something as simple as test and treat. So now we're going to listen to Dr. Morrow. She has another interesting case that I think you will enjoy.
Hi, my name is Dr. Cynthia Morrow, and I am an integrative small animal veterinarian practicing in Pittsburgh, Pennsylvania at Cranberry Holistic Pet Care, and that's in the U.S. in PA. I'm north of PA, north of Pittsburgh. I would like today to present a case. It's a feline case, and it's a complicated case with a cat patient named Louie Bradley. I'd like to first make a couple comments about vitamin D levels. I've been running them in my practice for many years now, and in the last year, I've run 361 vitamin D levels in my patients, both dogs and cats. I find vitamin D is an important piece of the puzzle in complicated cases, and especially in those patients who are suffering from autoimmune disorders, those requiring immune modulation or upregulation of immune function, also in patients with chronic skin, gastrointestinal, neoplasia, and other complex involved cases that I tend to see. Vitamin D alone, I don't find to be the total solution in these cases, but it is a large portion of impacting immune functions and immune modulation. And Louis is one of those cases that I will be presenting now. Louis presented to the local veterinarian in July of 2019 with symptoms of lethargy, right forelimb lameness, and right shoulder swelling. He also had hyperesthesia of his shoulder and was self-traumatizing. It was suspected that he had soft tissue trauma, and when he was evaluated for the possibility of an abscess, there was none found. He was treated with convenia, buprenorphine, and some NSAIDs, including Onsior, both injectable and oral. When he re-presented to the veterinarian, the attending veterinarian, 1 week later in 2019, he had actually a symptom of aggression and hyperesthesia that developed. His lameness had temporarily resolved, but he had more intense skin inflammation and alopecia with over-grooming of the dorsal neck and upper thoracic skin. The attending veterinarian decided to perform a cutaneous biopsy, but found normal cells with a mild inflammatory reaction and some superficial bacteria. His diagnosis remained open, but he was treated with an Elizabethan collar to stop the self-trauma, and he was put on a different antibiotic, marbofloxacin, and Pepcid, as well as Benadryl. And the Benadryl was being used to help dampen the hyperesthesia and over-grooming symptoms. The patient continued to have problems, and he would make temporary improvements and then relapse with symptoms. So in August of 2019, the attending veterinarian referred to a neurologist for a complete neurology workup, which included an MRI, a CSF tap, and bone marrow biopsy. At that point, they were testing for neoplasia, infection, and inflammation, but the MRI had minimal cellularity, and the CSF had minimal cellularity, and the MRI was negative for neoplasia. A bone marrow biopsy was also performed. The diagnostic tests performed at the referral center included several infectious diseases, toxoplasma, cryptococcus, mycoplasma, leukemia virus, and feline immunodeficiency virus, in addition to FIP tests, were all negative. He did display an increase in alkaline phosphatase and a mild neutropenia, but he was on prednisone at the time. So those changes on the hematology and the alkaline phosphatase were attributed to the prednisone or prednisolone therapy he was undergoing. The bone marrow biopsy showed a mild neutrophilic hyperplasia. He was diagnosed with immune-mediated encephalomyelitis with ataxia, right-sided hemiparesis, and a left head tilt. In addition, he had rotary nystagmus, and a loss of peripheral vision in the left eye, along with an inconsistent menace. The referral clinic put him on a course of pratofloxacin followed by clindamycin and fortiflora, which is a probiotic made by Purina. He was also put on Pepcid and immunosuppressive doses of cyclosporin, and that was the Atopica brand of cyclosporin, along with continued prednisolone at 5 milligrams BID. He continued to see the specialist, and he had between August and November of 2019, 11 veterinary visits, including 2 hospital stays in the referral center. He was still displaying neurological signs, and he'd show some improvement, but then regardless of what medication he was on, he would relapse or worsen with his clinical signs, and those signs progressed to anisocoria, loss of peripheral vision in both eyes, facial hyperesthesia, which was pretty marked, and a loss of balance, including falling off of furniture while he was resting. And he also progressed from a right-sided ataxia to complete right-sided hemiparesis. He presented to my veterinary clinic with the intentions on the owner's part of the pet receiving acupuncture and an integrative approach to his care, since he was not having sustained improvement. And their biggest concerns were that he had continued hyperesthesia of his neck and tail base, constant agitation, and disinterest in quality of in play and loss of his former personality. They felt that his quality of life was really suffering in spite of being on medications. When I saw him, he did not have any differing clinical signs than those that he had had at the veterinary neurologist. There was an anisocoria, as previously reported. His previous right forelimb lameness had reoccurred, and when he presented to my clinic, and he had circumduction of the right forelimb and a decreased posterior phase of his right front limb stride. He had delayed pupillary light reflexes in the right eye, direct and consensual. And the medications he was receiving at presentation were the continued cyclosporin and prednisolone, and he wore an Elizabethan collar pictured here at all times. At my clinic, I tested him for several different conditions which were not tested before, including Bartonellosis, and his Bartonella test was negative. Blood glucose monitoring was normal at 149 milligrams per deciliter. He was negative for pancreatitis. A heartworm antigen and antibody test were all negative, and thymidine kinase testing was done, knowing that it would be falsely lowered by his immunosuppressive therapy. He tested normal at 1.3. Haptoglobin was markedly increased in spite of prednisolone and atopica therapy or cyclosporin therapy. Vitamin D was below normal at 73 nanograms per milliliter. And I wanted to test his vitamin D because he had been on steroids for quite a while, and I suspected it would be low. He also had a non-regenerative anemia and neutropenia. His diagnosis at the time he presented to me was autoimmune neurologic disorder, and his TCVM or Eastern medicine diagnosis was liver qi and blood stagnation with wind and heat invasion. And it was important to make this diagnosis because the owners were seeking acupuncture and Eastern medicine treatment. So I created a treatment plan which would fit Louis' tolerance for therapies. And when he presented to me, he needed to be fully anesthetized for blood draw and a full physical exam because his hyperesthesia was so intense that I could not touch his face. I could not touch him along his back or tailhead. So acupuncture was not a really great option. So instead, I performed needleless acupuncture, a form of Qigong acupuncture, and I started transitioning him to a hydrocortisone therapy, and I began tapering him from the prednisolone therapy. Between November of 2019, when I initially saw him, and March of 2020, I was able to taper him completely off of his cyclosporin and prednisolone and adjust his Chinese herbs while also continuing to monitor vitamin D3 levels after institution of vitamin D3 as therapy. I saw him every 2 to 4 weeks as the owners could bring him in. And I also did a treatment called NAET, which is non-boudrepaud's allergy elimination treatment for immune system balancing. And I frequently do this treatment for patients with autoimmune disorders and oncology patients. I continued Vitalite therapy and I toggled it and switched it with Innovarious sauna wave treatments of his entire dorsum. And Innovarious sauna wave delivers pulsed electromagnetic field therapy, radio frequency hyperthermia, and sound frequencies to establish normal tissue function and frequencies. His treatment response produced a resolution of hyperesthesia, and his self-trauma resolved. So he was able to have the Elizabethan collar removed. Initially, just when the owners weren't watching him, he would wear his e-collar, and then he was able to have it off all the time. His right forelimb lameness completely resolved, and his neurologic signs resolved. So between March of 2020, at the beginning of COVID, and October of 2021, the pet was asymptomatic, and he did not receive any therapy at my clinic. In October of 2021, he presented to my clinic and had routine blood work. And at that time, he tested FIV positive. At a follow-up 2 months later, he was still positive for FIV. And we modified a treatment plan to address the positive retrovirus status. I included Artemisia annua, continued vitamin D3 therapy based on his current testing, and I began Raymaker's transfer factor with therapeutic mushrooms and resumed his sauna wave and NAET treatments. Between November of 2022 and the present time, he has been FIV negative with no relapse of neurological signs. He does not wear his e-collar, and the owners chose to reduce visits mainly due to financial reasons. They've reduced the frequency of diagnostic testing, but owners have chosen to continue monitoring vitamin D3 levels because they really feel that vitamin D was key to his improvement along with his other treatments. Vitamin D3 is also very easy for them to administer along with their pet's food. So they continue treating with the supplements as prescribed by me and doing NAET and chiropractic care every 2 months. Currently, he has been reduced to only 2.5 milligrams of hydrocortisone twice a day, and that is his only medication at this time, in addition to his supplementation with vitamin D3, RX Vitamins Ultra EFA, and the therapeutic mushrooms, and also the standard process whole body support, whole food vitamin supplementation. Louis is really happy and easy to medicate with these treatments. And the biggest improvement is for the owner is that he is really himself and he's playing with them and he's active and interacting. In summary, vitamin D3 is really significant in Louis' case because of its ability or its role in allowing him to be on a lower dose of prednisolone and eventually getting off prednisolone therapy. And it's also been a key factor in both the owner's observation and my observation in producing sustained and dramatic improvements in immune modulation and cessation of pain and hyperesthesia, improved immune function, conversion from FIV positive status to a negative status, improved red blood counts and white blood counts. Musculoskeletal function has remained normal, and the owners are very happy about that. And he's had resolution of his right forelimb lameness. Thank you very much.
Well, thank you, Dr. Morrow. That was quite interesting. Louis is quite a cat, and it seems like you had a complex case there that you were able to successfully navigate. So we'll close on really when should you be testing for vitamin D? Well, any pet, any cat and dog over the age of 1. Um, our reference intervals begin 1 and older. We don't have reference intervals for a puppy. Although if you do, suspect like tulip, or you have, the potential case for something like rickets, then yes, you should test and deal with it accordingly. But we recommend to test greater than 1 and be part of your annual campaign, meaning that every time you're doing, annual visits for vaccinations, dental cleanings, routine chemistry, CBC, add a vitamin D. It's that easy and something you should be done. Certainly diet changes should be looked at, especially because the diet is the primary source of vitamin D. So you can imagine if you're changing the diet, then vitamin D levels could change. And this should happen within 3 months after the new diet starts, because you got to wait for equilibrium to occur. Any major healthcare changes, once they're resolved, you should test for, because those healthcare changes, like let's say the patient develops IBD, well, certainly that's something that you should then, look at, rectify, and correct accordingly. And we believe that vitamin D is very important in many different types of diseases, whether it be cancer, renal disease, GI disease, especially if pets are on steroids. Steroids consumes vitamin D. We didn't get really into it, but I'm just going to tell you that the nuclear receptor that is used for calcitriol in these cells and the nuclear receptor for corticosteroids they're shared, and there is actually an amplification effect, which is why that one study looking at atopic dermatitis patients where there was a steroid sparing effect, because vitamin D is actually, or calcitriol is actually consumed with corticosteroids. So you want to make certain if you've got patients on steroids that they're vitamin D replete, because you're giving steroids for a medical reason. Make certain it's effective. Check for vitamin D. So I want to thank you for your time here. We learned that there are different forms of vitamin D, and becomes what I like to call the most important hormone, calcitriol. It is made intracellularly, has a lot of regulatory effects, particularly on immune modulation. We know that there's a lot of dietary insufficiencies that need to be detected and then corrected through a test and treat campaign, that there's a growing body of veterinary studies that are showing that vitamin D is important. And now we've identified when that you should be testing on a routine basis. So I want to thank you for taking the time to listen to us. And I hope vitamin D becomes a key part of your routine operations within your clinic. Thank you.